So Steph Curry recently had an injury to his lower leg that is leaving him out of the NBA indefinitely. And when they got the MRI report back, it showed that he had a partial tear to his superior tibiofibular ligaments as well as his interosseous membrane. Well, number one, what are those injuries and why is his recovery timeline potentially so long? Let's get into it. Now, the tibia and fibula are the bones that make up the bottom of your leg. Tibia on the inside, fibula on the outside. So it makes your ankle joint all the way down at the bottom, as well as provides the inferior or underside platform of your knee. And these two bones take up a ton of force, both in the axial direction or compression, as well as rotational type injuries, as well as blunt type forces. Now, Steph Curry's particular injury to the leg is an injury to the anterior superior tibiofibular ligament. That is a mouthful. The posterior superior tibiofibular ligament, the one in the back, as well as probably the one on the inside or the interosseous, as well as the interosseous membrane. Now, the interosseous membrane is this really thick band of ligamentous tissue that connects the tibia and the fibula. It's also what allows your leg to act as one unit. And so when you injure these structures up here, a couple things really start to go haywire. Number one is your leg's ability to deal with shock or compression. Because remember, the femur sits on top of the tibia, right? So it doesn't look like the fibula is doing anything. However, the fibula is responsible for 17% of your body weight. So if you come down on this and these two bones aren't attached correctly, well, now your knee joint is unstable. And it's not only unstable in terms of shock or compression, but now it's also unstable in terms of torsion. And that's where you can get an unstable knee joint. The second issue is that down south from these structures comes your ankle joint. And so every time you're trying to push off for a jump shot, remember your ankle or your talus is shoving into your ankle joint, right? And that's wanting to separate these two bones. It's held in by really strong ligaments. However, when there's a tear in that ligament, number one, it can keep getting weaker and just cause more pain. But number two, I mean, the whole thing could start to separate, and then you've got a leg that doesn't act as one leg. Now it's acting as two separate structures, one going east, one going west, which obviously isn't great for anybody. And the next thing that goes haywire is your leg's ability to deal with torsion or rotational stresses. Because as you walk, run, or jump, remember your leg is actually going in a circular direction too, not just front to back or up and down. And so when you start putting all those rotational forces on there, that leaves the bone more prone to breaking, or number two, spraining, subluxing, or dislocating an ankle joint, or having your knee do too much work and end up snapping a ligament up north because your knee joint is trying to compensate for the weakness right below it. And the other thing that really goes haywire is your body's ability to heal these injuries, because ligaments, number one, just don't have great blood flow. They don't really want to heal that well on their own. And number two, if you've had chronic ligament issues like Steph Curry has had, remember you start to get scarring in there, and ligaments just don't handle scarring very well. They also don't handle repeat injuries, because if you watched him on court, it didn't look like he did very much. He kind of really leaned on the outside of his knee, and that's really when it went. And my guess is this thing's been brewing for a while, or he's had a rotational injury to this leg in the past, and then it really popped on Saturday night. So I think that's really what you're seeing here, is that, you know, when he comes back to play on this leg, you really better make sure it's healed properly, or it's just going to do it again, or you're going to get an even worse injury up north in your knee or down in your ankle joint. So with all that, it's not really a surprise that Steph Curry is out, quote unquote, indefinitely. It's going to take a while to see if those ligaments are healing properly and if they're going to be strong enough for him to come back and play NBA basketball, especially since his number one weapon is his jump shot. And to hit an effective jump shot, you better be able to push off on your legs evenly so you don't start tilting unevenly in the air because one leg is either hurting or just can't push off, and then the ball starts to veer east or west, kind of like mine always do. And number two, you got to be able to trust that when you come and land back down, the knee joint, the ankle joint, and just the leg in general can handle that compression as well as rotation, because if you're not confident in that, you're not going to want to get up as high for that jump shot, you're not going to get the arc you used to, and your accuracy is going to start to dip. Plus, anytime you're trying not to get injured, what happens? You get injured. So I'd say for this particular injury, I'd probably be measuring the recovery in months, not weeks, unless he really does have a miraculously quick recovery, or the MRI kind of oversold the injury. I'd kind of be looking at the 8-week mark to really get imaging to see if things are really starting to consolidate really strong, and the 12-week mark to really see if you can hit an effective jump shot. And even that's being a little bit snappy with the recovery. It could last longer. But like all things, you know, time will tell. He may recover quicker. He is a young and healthy person. It's not the same as a 65 or 70-year-old person doing the same thing to their leg. So if you do want to see some of the other issues that Steph Curry has been going through, especially with his ankle, I actually do have a video explaining that up above, and make sure you subscribe down below. Respect your rubber and foam and ankle and knee and all the ligaments in between. I'll see you in the next one.